towards value-based care. What are your thoughts on it? What are the problems you saw, and how do you see this value-based care evolving from here?
Sure. um, One of the things that I noticed in my career at Kaiser Permanente, and I've been watching this closely, is that um, if you take, what are the preventable things? And if you take care of the prevention part, how will the outcomes change? And I've seen this in my own lifetime. Um, at Kaiser Permanente, and this is published data, and how they were able to drop the heart attack rates by 30%,
Mm-hmm.
the stroke rates by 50% compared to the community. And you would think about it and then say, oh, okay. So in the past, the idea was that, oh, if you had a heart attack, oh, okay, you got a heart attack, too bad, or bad luck. But now we know that, okay, if you have a genetic predisposition, if you're smoking, if you have diabetes, if you have high cholesterol, if you have hypertension, maybe your rate is pretty high. Okay, so genetic predisposition you cannot do anything about. So forget about that for now. But these other four, you can actually make a difference. How you can, you know, encourage the patient to stop smoking and why it is important. And how do you control your sugar, your cholesterol, your blood pressure, right? So we think about these things as diseases, the diabetes, and so as a researcher, I don't think about it as a disease. I think about it as a risk factor.
Mm-hmm.
So every single thing is a risk factor. Well, if it is a risk factor, then you have to figure out where this risk starts. And what are the other risk factors for this risk factor? Is obesity a risk factor, or lifestyle? Is the food we eat? And so that's number one. So everything I look at it as a risk factor. A risk factor for a bad outcome, which is it could be a stroke, it could be diabetic retinopathy, it could be heart attack, it could be peripheral vascular disease. All these things add up as risk factor for these bad things that happen in the end. And that's why you see the preventive the U.S. Preventive Task Force. It changes the guidelines. It says, oh, more people at this lower level are also at risk.
Right.
More